also what's going on across the state and also the country. And so from that vantage point, let's go ahead and get started. I want to make certain we get started with Dr. Huang and spend as much time as possible with him on this particular issue.
Yes, Senator West. Hi, thank you for having me. It's an honor to be here. And unfortunately, what I'm going to be reporting today is we are obviously seeing an upsurge in the cases. In Dallas County, we moved from the orange transmission level up to red just last week. Okay, in the trauma service area, E, for instance, we just reported yesterday over 2,000 COVID patients in our hospitals. I think exactly 2,036. That was an increase of 57 from the prior day. But just to put it in perspective, on July 6th, we had 468 persons in the hospital. So going from 468 to 2,036 in just a little over a month, it's almost over 5 times the number of what we saw then. We also that's representing 14% of the bed capacity and 34% of adult ICU patients. So over a third of our ICU patients now have COVID-19. So we currently, the number in this trauma service area E, we have about 98 available adult staffed ICU beds, and we have 251 adults on ventilators with COVID-19. Also, another alarming situation is we actually have 51 confirmed COVID-19 pediatric patients hospitalized, and that's about 3 times the volume of a month ago. And that's what we're seeing is this, really tremendous increase in the numbers again on our healthcare system. So definitely the hospital systems are reporting a lot of stress with this. The workers are, and I think that's one of the biggest stresses, just the burden and the workforce. They've been doing this for months, and now with these increasing numbers, it's starting to get even more challenging. I mean, because the thing is also about this, that it's almost all preventable. Almost all of these hospitalizations are in persons who have not received the vaccine. The deaths that we're seeing, almost all of them are among persons who have not been vaccinated. And we now, as you know, have abundant supply of this safe and very effective vaccine now. So this is part of the frustration. In Dallas County, I think our latest numbers, we were about, when you count the eligible population, say persons 12 years and older, we're at about close to 63% have received the first dose. But then if you look at the total population, including those persons that aren't eligible, age 0 to 12, the percentage of persons who are fully protected is still less than 50%. So we still have, around 50% who are not fully protected or protected from this. And then with the circulation of the Delta variant in our community, and that has now become the predominant strain circulating. The Delta variant is extremely, about twice as easily transmitted as the original strain. And it is, we're seeing that it is accounting for much more severe illness also. Now, the good thing about is that the vaccine is still, it's effective against preventing hospitalizations and death and serious illness, even with the Delta variant. But what was identified then in the recent weeks is that people who've been vaccinated, though, can still carry the virus in large amounts of the virus, even though they're not getting as seriously ill, which is a good thing. They can carry more of the virus and transmit it to others, which is why then the CDC changed some of their guidance in terms of recommending that persons who are fully vaccinated still use the mask also when they're indoors or in public settings or in close proximity to others. So that is accounting, it's not, the vaccines are still very safe and effective, and they protect people against hospitalizations and death. But what we've seen is that the fully vaccinated people can carry the virus and transmit it to others.
Well, Doc, let me ask you a question. First of all, thank you for your presentation. I've got a few questions, and there may very well be others here too. You indicated that about 50% of the people in Dallas County are protected. So there's 50% that's not protected. Do we know what geographical area the unprotected people live in Dallas County?
We do, and we actually have very good information on that. We've been every 1 to 2 weeks putting out a list of even down to the census blocks, which is a subunit of the zip code. So we know the census blocks and the level and percentage of vaccination coverage in those populations. We've actually been using those. So I didn't talk about all the efforts we're doing, looking at that data and in a very granular way is a lot of what we're doing. We're sharing that with our community partners so we can target some of those high priority areas. We've been doing block walking in those census blocks that have the highest unvaccinated rates. There are census blocks that had 75% or more that were unvaccinated. We then sent out text messages to all the persons in those areas, encouraging them to get the vaccine. We've been doing a lot of pop-up clinics and working with community partners to offer the vaccine at various community sites and working with them to encourage whether it's a church congregation or other groups to provide that and encourage their members to get the vaccine. We've also, Fair Park was our hub mass vaccination site. We stopped doing the large mass vaccination site July 17th, but we're continuing now to do every Saturday, and they're out there today actually just doing a pop-up in one of the parking lots because we're still getting at least about 500 persons a day when we open on Saturdays getting the vaccine. Just keeping in mind, we had gotten to the volume where we were getting up to over 12,000 shots given in one single day. Actually, the numbers, Fair Park became the largest single hub vaccination site in the state of Texas and one of the top 3, I think, in the country. Today, with our numbers, we are like at 499,500. We're thinking we may surpass the 500,000 mark in number of shots administered at Fair Park today. So that's been, again, a very important piece of that. Parkland Hospital has been doing so much. Also, they've been running Ellis Davis, also doing a lot of vaccination at the new Parkland campus and also at other pop-up sites. And many of the hospital systems are continuing to offer it, UT Southwestern also. So those are a lot of the efforts. We're working with a media company to get the messaging out, targeting the various communities and support these. At Fair Park, we're going to continue the Saturdays up till the state fair as it's scheduled in mid-September. And we're actually working with them to have a presence during the fair every day. We've also, our commissioner's court has approved for us to purchase the $20, 2 pages of those coupons that you use to buy corny dogs or get your rides at Fair Park during the state fair, so that anyone who gets their shot during that can get 2 pages or $20 worth of that. We've had anyone who's been going to Fair Park or any of our Dallas County Health and Human Services sites and getting a shot the last several weeks has been getting free Six Flags passes, or alternatively 2 passes to the Dallas Zoo. So we'll continue with all those until we run out. And then we've also gotten approval to have $25 gift cards that we can give as incentives after those run out. So yeah.
2 things. So in terms of Dallas County, what area has the least number of vaccinated citizens? What areas?
So, it's much of it has been, and we've been working with some of the zip codes, that priority zip codes in some of the South Dallas areas. 75243 is another area that's more further north, but has also been some of the higher areas. What we've seen, we've actually been very successful getting the 65 and age and older populations vaccinated, which is a good thing. And so many of those, though, are areas also with younger population. So even some of the areas central, even some of the areas around uptown and those areas, because of that demographic, have had lower vaccination rates.
So what I'm hearing you say is South, you said South Dallas.
South Dallas is certainly, that's
okay.
Historically one of the areas. I mean, that's why we located Fair Park as one of our mass hub sites, and Ellis Davis. The last probably month or so at least at Fair Park and throughout, if you look at the demographics of who has been taking advantage of Fair Park, we've had even 60 to 70% Hispanic, 15 to 16% African American. So those, some of the areas in those areas have been taking advantage of Fair Park, which has been good.
Okay, but we're still having a hard time in the southern sector.
Yes, that remains, certainly one of the areas.
Let me finish.
Sure.
Are we still having a hard time getting people in the southern sector to get vaccinated?
Again, that's certainly one of the target areas. We've had a lot of support from a lot of the churches to get their congregants, their members to get the vaccine, and we've been partnering with them in South Dallas. We've been doing a lot, as I mentioned, a lot of block walking in those areas.
Sure, yeah. And I just want to make certain that we kind of obviously work with your office and needless to say, those organizations in the community to try to get as many people vaccinated as possible.
Absolutely.
Yeah. In terms of the chat box, we have several questions in the chat box. Lawana, am I supposed to ask the questions, or are you asking the questions, or what? I guess I'm asking the questions. Where can we get the census block data in terms of persons that where we have people that have taken vaccinations and people that haven't? Where can we get that?
Yeah, I can send it to you. We've been doing weekly calls with our partners, the hospital systems, the other FQHCs, pharmacies, to make sure and share the information that everyone has regarding vaccination. And so we've been now sending that out to the group, as well as, which areas we know that are doing different pop-up efforts, things like that. So it's
online or what?
It's not online. I can send that to you, not to that granular level, that granular analysis down to the census block level. I can send it to your office.
Okay, so I think Eve Williams asked that question. And so Eve, you can contact our office and we'll make certain that we do that.
Okay.
Okay. Other question is, this is from Imad Salam. The question is, how effective have Dallas County been in getting more people to get vaccinated, and how can we help?
Well, again, okay, so right now, we're about 63% of the eligible population 12 and over who have gotten at least one dose. What we found, if people get that first dose, most of them get the second dose. About 90% of people get that second dose. So, anything the different groups, if your group, to make sure that they're vaccinated, and if not, to take advantage of the availability. I mean, I mentioned some of these sites that we have, but also they're at your neighborhood grocery stores, drugstores. Those groups have been a great partner in this. They are now, readily available at all those sites. throughout Dallas County. You can just walk in. You don't even need appointments, or you can go to, Fair Park or Alice Davis or some of these other places. But it's readily available, a lot of private physicians' offices. But anything anyone can do to also dispel the myths. I mean, there are still questions people have about it. These are safe. They're effective. We've had hundreds of millions of doses that have been administered. They are, despite, what we've been saying about, some of the changing mask guidance, they are extremely effective at preventing hospitalizations and death. Some people we hear are concerned about the side effects. If anyone can help educate the people, that it's nothing compared to actually getting COVID disease, that, you might have a sore arm or a body aches or things for a few hours the next day. But again, that is nothing compared to getting actually the infection. And we still have, as I mentioned, some of the childhood hospitalizations, the numbers in the hospital we're having fewer deaths, which is great because, as I mentioned, we've been very successful at getting 65 and over vaccinated. I think in Dallas County, 85% of those 65 and older have received at least one dose, and 75% or 74% are like fully vaccinated among the 65 and older. So that's been effective at decreasing the mortality rate and decreasing the hospitalizations for that population. But again, it's this younger group now that we're seeing are accounting for more of the hospitalization, deaths, and severe illness. And it's because that younger population has not, we don't have as high rates in vaccination. So anything that anyone can do to encourage those groups, if they interact and work with them, to encourage them, that's helpful.
So in terms of the variant and specifically the adolescent population, what are we looking at in terms of this Delta variant, especially with kids going back to school and the governor's executive orders?
Well, again, that's very concerning. The governor's executive orders are not consistent with our recommendations or with CDC recommendations. CDC is recommending that kids in school wear the masks, be required to wear the masks, to keep that physical distance, although in schools it's now been decreased to like 3 feet or more. But also, if there are any kids in school that are in the eligible population, right now the vaccine is only approved with emergency for 12 and older. But that 12 and older, if they're in school and they're not vaccinated, they need to get the vaccine. That's the top priority. But then also to be doing all these other prevention efforts, to be wearing the mask, to be doing the distancing, to be avoiding crowds. Also, the schools, should make sure there's adequate ventilation in their systems. All of those things sort of in a layered approach to help protect the kids. But it is not, the restrictions on requiring that are not helping us. And we have a lot of concerns about that.
Well, there are a lot of several school districts in the state that are looking at defying the executive order and taking it to court. And so it's going to be interesting to see exactly how that fares out. Given CDC is making certain recommendations, and it appears as though that some governors are going in the opposite direction. So it's going to be interesting to see how we work through this. Here's a question, and you may or may not know this. We have the state fair opening up. And there are millions of people over 1 million people attend the state fair every year. Has that been a discussion at the health department in terms of what should or should not be done?
As the situation continues to evolve, I think when the decisions to open were made, certainly we were in a better place. I think we're all looking at those recommendations. Outside is better than indoors, and so much of it is outdoors, but there's certainly a lot of indoors or crowding. Assuming, I think would be efforts to make sure that everyone is masked. And I know there have been discussions about handing out masks and making sure that, assuming everything goes forward, that those would be provided. I mentioned that the efforts to get and offer the vaccine at the fairgrounds. That's the thing, that vaccinated people, there are more things that vaccinated people can do, as was evidenced by the CDC guidance. Now it's saying just wear masks. when you're indoors or around other crowds. But it's this unvaccinated, the fact that we have such a large unvaccinated population, that's still what, I think is very concerning. So, I mean, it certainly would be taken into consideration regarding all the future plans. And Fair Park has been such a great partner throughout this, because they recognize also how important it is for them being able to proceed with having the fair occur.
A couple of other questions are coming in left and right now for you, Doc. I can tell you that now. Has any targeted survey been done to identify the reasons for vaccine resistance in these lagging areas?
There have been a lot of various surveys, no specific targeted ones in these. I think what we're hearing are these consistent findings of what are the reasons for different persons' vaccine hesitancy. A lot of people saying, well, it's still not fully approved by the FDA. We're hoping that's remedied in the near term. So to address that concern people have, distrust of government, distrust of the entities that are providing this vaccine, saying it was too rushed, it didn't go through all the processes. Again, these are myths that we can debunk. They're not true. Then again, as I mentioned, some of the surveys indicating, I think the last I saw was like 34% of persons were concerned about the side effects. As I mentioned, the side effects are nothing compared to actually getting the disease. So there are definitely a lot of information about and more research done why people aren't getting the vaccine. Some of it, but less so in terms of the convenience or the availability, certainly compared to earlier on, because it is much more available, certainly, than it was.
That's a good transition. And that question came from Grace Smith. Grace, thank you for that question. And then Dr. Quinn Morrison has a question. If someone wanted to get a vaccine today in the Metroplex, be it in Tarrant County or Dallas County or North Central Texas County, where's the best place to go to find out those locations?
So there is a site, vaccines.gov, and that you can click on that and you can put in your zip code, and you can, it shows all the different areas. It shows which vaccines are available at the different sites. So that's a pretty centralized resource that you can use to find vaccines available. That has pharmacies, it has grocery stores, it has our sites. So as a start, vaccines.gov.
Let me ask you one more question before we bring State Representative Jasmine Crockett on. Is Dallas County's health director able to impose mask mandates for Dallas County schools similar to what's happened at Travis County last year?
Unfortunately, the interpretation of the governor's order is that, we all are prohibited from doing that. So again, that's very concerning, but we've had to deal with that throughout the pandemic. I mean, our philosophy, we have our guidance out there. We have updated guidance now since the vaccine's out and when we went to red. But we've had to say, just because you can doesn't mean you should, and that we have our recommendations from our local experts in public health, epidemiology, infectious disease, that we put out that guidance and said, we do recommend everyone wear the masks. The private entities can do that and put that requirement also for vaccines. And we're seeing the hospital systems have requiring employees to be vaccinated. I think Walmart, I heard, was requiring employees to be vaccinated. We would encourage any groups that can do that. That's a good way. That's probably the next level of what we need to do to be effective. Senator West, I know you've been very involved in tobacco over the years, as have I, and have looked at some of the lessons learned. It came to a point where you could, people knew smoking was bad for you and it causes cancer and lung disease, but it wasn't then until you started having more policies like requiring smoke-free air in places and other things that then you got that to that last hurdle of those more, persons that are more resistant. And we're probably getting to some of that where policy is part of what it takes to help, those persons move to getting vaccinated. Some of the, strategies have also heard about, perhaps then you just require testing, regularly, but they can, if they show proof of vaccination, then they can get out of having to get tested all the time. But, again, I think that we are probably getting to the point where policies among employers might be useful. And it's good to see that some are taking it.
That's exactly right. It's evolving. I can tell you that. It is in fact evolving. And let's make sure we continue to do that. You've been very gracious with your time this morning. I appreciate it. And I appreciate you answering questions. You know that we are here to partner with you on any health-related needs that we have in Dallas County and the state of Texas. Thank you for your input. Thank you for your advice on policies that we have in the state of Texas.
Well, thank you so much for all your leadership and support in this. I mean, we really appreciate it. Thank you.
Have a great day.
You too. Thanks.